Hi, everyone, and welcome to this week's webinar. My name is Loretta Maddox, and I am the Account Executive and Compliance Specialist here at Healthcare Compliance Pros. I also have with me today Chad Schiffman, who is our Director of Compliance, and then as always, we have Nicole Mark, our Marketing Manager, and she will be managing our poll questions today, as well as moderating any questions that come in. So we took last week off, and I hope that everyone enjoyed the Memorial Day weekend. I know it was good to have a little bit of a break, maybe not a ton that we could do, but it was nice to have a little bit of a break. But now we are back today to continue to provide just relevant updates during this current public health emergency. But also we want to give you some practical information to help you manage compliance within your organization. So before we dig into today's topic, I do want to, hang on just one second because we are having some difficulty advancing slides. Here we go. So I do want to remind everyone, we do have the toolkit available. We are constantly adding new resources to that toolkit. In fact, yesterday, there were 2 new modules that were released, and they are tips for working remotely and then returning to normal operations. So if you have not checked out the toolkit or you have difficulty getting into the toolkit, please contact your compliance advisor or reach out to us, and we will help get you what you need from the toolkit. So we are going to talk today about some updates because we have had a few updates that have come out over the last couple of weeks since we spoke last. And then we're also going to take a minute to look at the OIG Strategic Plan. And before we get into that, I do want you guys to be thinking about what you want to hear from us next. Chad and I have worked on topics that we think are going to be really good for you as we move forward, not specifically related to the public health emergency and COVID-19, but also just from compliance as a whole and things that we have learned from this situation. But we really want you guys to tell us what is going to be helpful to you. So at the end of this presentation today, we're going to give you an opportunity to answer a poll question. We're going to give you a couple of topics to choose from, but we're also going to give you the opportunity to fill in a topic that we don't have listed. And the way that you're going to do that, we'll give you instructions on how to do that at the end because it's going to be a little different than our normal poll questions. But with that, we are going to go ahead and jump into the update. The first one I want to talk about is the CARES Act Provider Relief Fund. So there's been some information that has come out on this, and honestly, I have to tell you, as I was putting this information together, Chad and I were looking at it, and there was a lot of conflicting information, but here's what we believe this is right now. So HHS announced that they were going to extend the deadline to accept the terms and conditions for the payments that you received from the Provider Relief Fund. So this is a 45-day compliance extension, which actually gives you 90 days from the date of receipt to accept those terms and conditions. And again, I have listed the website where you can go to do your attestation. Now, in addition to this extension, there is also a deadline, and this is what made it a little bit confusing because these 2 pieces of information came out within 2 days of each other. So June 3rd, which is tomorrow, is the deadline for you if you want to receive additional funds from the General Distribution Fund. So if you did receive additional funds or if you were requesting additional funds, you have to submit tax return information, and that has to be done by tomorrow. Now, the confusing part was that if you haven't received these additional funds and you want to request them, tomorrow is the deadline for submitting those financial documents. If you haven't received those funds and you submit those additional documents by tomorrow, from the date you receive the funds, you will then have the 90 days to accept or to attest. So I know that's a little bit confusing, but we did want to point those deadlines out, especially since June 3rd is tomorrow. And so if you did plan to request any additional funds, you do have to submit those tax documents by tomorrow. So we're going to go ahead and jump into our first poll question, because I'm just really curious to know from the audience who has received funds. So Nicole, if you could get this poll up. Okay, here we go. So it's looking like, and I know you guys can't see this just yet, but it is looking like over 90% of you have received funds from the Provider Relief Fund. Now, this was in the first round of payments. All right. So the next question I want to ask is, here we go. Did you receive additional funds? And there we go. Did you receive additional funds? So this would be if you received that first round around, I believe that started on April the 10th, but then you received additional funds after that. All right, so some of you did. I wasn't really sure what to expect on this particular question. So 73% of you, and we're still waiting on a few others to vote, 73% of you did not receive additional funds, but 27% of you did. And so, again, those that received those additional funds, that deadline is tomorrow for you to submit those financial documents. And if you have additional questions, we can send you some links for that. All right, our next poll question. Those of you who have received funds, have you accepted the terms and conditions using the attestation portal? Nicole, are we able to put the results on the screen, or other people seeing it? Because I'm not.
Oh, yeah, they're popping up on mine.
Okay. Okay, it's probably just me. No, we're good. If you're seeing it, then we're good.
Okay.
All right. 100% of you, that's fantastic. 100% of you have accepted the terms and conditions on the attestation portal. And then, okay, so that was very interesting, because I wasn't sure if there were going to be difficulties in doing the attestation, but it is good to see that those of you who did receive funds have attested. So our next update has to do with just some frequently asked questions on the Medicare fee-for-service billing. And I've put this link in because this is a 71-page document of FAQs that it's basically, CMS has released these to help providers, which include physicians, hospitals, rural health clinics, find more answers on all of the waivers that have been related to the COVID-19 situation. So I wanted to put this information out there in the event that you have not seen it, but things that you might want to look for in this FAQ document are things related to outpatient therapy. There's a lot on telehealth and how to code appropriately for that. And then if you fall into the category of a federally qualified health center, there are quite a few questions related to that as well. Next, I want to talk about, and this is just yesterday, this came out. And so CMS has issued some clarification for using the CR modifier and the DR condition code. And so if you're not aware, the CR modifier is catastrophic or disaster related, and this is for Part B billing, both institutional and non-institutional. And then the DR condition code is disaster related, and that is specifically for institutional billing. So if you've submitted a claim that is pursuant to a waiver and it did not include the modifier, then your claims may have been denied. Not necessarily always denied, but they may have been denied. So in order to see what those waivers are, if you need to take a look at those waivers, I've included the link here on the slide. You don't have to resubmit any claims if they were missing a modifier if you were paid. But if your claim was denied or you were not paid appropriately, then you can resubmit those claims with the appropriate modifier. And just a couple of things that would be included in the waivers that would require these modifiers would be DME is a big one. There are several things. So if you're a supplier of DME, you might want to take a look at this. Also, if you have a locum tenens in your practice or you're using one for an extended period of time, then there was a waiver for that to extend that 60-day period. So that is another example of claims that would need that particular modifier. So I just wanted to point that out to you guys in case that impacts your practice. So next on the list of updates is OSHA related. So the Department of Labor has adopted some revised enforcement policies, and we've talked about this a little bit, but what I wanted to focus on today is the increase in in-person inspections. And this is across the board, it's not just healthcare related, but what is specific to healthcare is that these inspections are going to be prioritized by workplace risk levels. And if you remember from previous webinars, the healthcare workers can be categorized in very high and high risk exposure. So it is likely that healthcare facilities are going to receive more in-person inspections. So what I take away from this is it is really important, again, just like other things we've talked about, to have your ducks in a row from an OSHA standpoint, not just specifically to the current COVID-19 issues, but in general. Because if you do have an on-site inspection and someone is coming in, they're more than likely not just going to look specifically at COVID-related issues. So you do want to make sure that you are in compliance, and now is a really good time to do that. One last thing that I want to mention is that during inspections like this, OSHA is going to look at whether healthcare or emergency response workers who are going to be performing those very high and high risk exposure tests are using appropriate respirators. So they will take into consideration some of the shortages, but again, I just want to remind you that now is the time to really make sure that we're doing what we're supposed to be doing from an OSHA compliance standpoint. So the final thing I want to talk about, and this may not be applicable to all of you depending on where you are in the country, but it is hurricane season. Atlantic hurricane season is June to November, Eastern Pacific, May to November. So we are right there at the beginning of something else to mess things up in your offices if you're in these areas. So, and I know it sounds like we are a lot of gloom and doom, but we really want to help you guys prepare for these things. And you may not be thinking about the natural disasters that we also have to deal with in addition to the COVID-19 issue. So what we wanted to just point out is that there are resources available for those of you who are in hurricane areas, and it's important that you have a plan in place for these. I'm sure if you are in those hurricane areas, you do, but it may not be at the top of your list right now because you have other things that you're dealing with. And just in talking about being prepared and responding to different emergency situations, it could be hurricanes, it could be tornadoes, it could be wildfires, it could be situations like I experienced yesterday personally. I had an eye doctor appointment and it was at the end of the day, but the office calls and says, we need you to come in early if possible because we are on a citywide curfew and we've got to make sure people get home because of the rioting that is taking place in the areas around the area where I live right now. So who plans for that? I mean, that's not something that you plan for every day. And it's not specifically that you have to plan for something like that, but I do believe that we are at a period that we have to plan for emergencies that can impact our practices at any given moment. And so that's why we wanted to bring this up and just things to think about, but also just to help you guys prepare for that, we do have resources that we can help you with. And as we continue to do our webinar series, we are going to touch on those different topics. So with that, I am going to hand things off to Chad and let him talk about the OIG Strategic Plan. Chad?
All right, thanks. Yeah, so we're going to chat a little bit about the OIG Strategic Plan, and it's basically with respect to COVID-19 response and recovery efforts. So the OIG just recently released their response and recovery plan, or their strategic plan for making sure everything runs smoothly with it, I guess, from the HHS angle. So in other words, they oversee it, want to make sure that all the announcements are in place, and as you can see, all the activities and actions or whatever by OIG or HHS are in place. Sorry about that. So as you can see by their mission, it is to provide oversight to promote economy, efficiency, and effectiveness and integrity of HHS programs, as well as the health and welfare of people they serve. So that's going to be, all the healthcare organizations, patients, and those types of things. Their vision is to drive positive change in HHS programs and in the lives of people served by these programs. And finally, their values are impact, innovation, and people focused. Now, what we're going to do is we're going to move through the OIG strategic plan, and we'll talk about each topic. But first, as a broad overview, their plan includes 4 goals. And those goals are, for one, to protect people. I think that kind of goes without saying. That's been the major goal for everybody with COVID-19, whether it's protecting patients, whether it's protecting your employees. All sorts of considerations have been in place due to COVID-19. And we're going to talk a little bit about what HHS is doing and then relate that to how practices are handling it. Second is protecting funds. That's been extremely important for HHS as it has been for healthcare organizations. We'll talk a little bit about that. Third is protecting infrastructure. So we're talking IT systems and things like that, and just basically anything to do within the healthcare organization, the facilities, and those types of things. But in terms of OIG, there's specific things that they're looking at there. And then finally is promoting effectiveness. We'll talk about that just a little bit, but the main 3 that are really important have been the, protecting people, funds, and infrastructure. So in our next slide, let's talk about protecting people. Now, during the COVID-19 pandemic, an essential responsibility for HHS is to protect the health and safety of people. OIG's said that they've seen unprecedented challenges this year for the delivery of healthcare in the American people. So to protect people, they thought, okay, well, here's 3 objectives that we need to look at. The first one is assist in and support ongoing COVID-19 response efforts while maintaining independence. So basically, they need to maintain their independence from HHS, but make sure that the COVID-19 response and recovery efforts are sufficient. They also are looking at how to best fight frauds and scams that endanger the HHS beneficiaries and the public, including patients. There are numerous frauds and scams going on all across the country right now. In fact, we're seeing an increase in these targeted scams. So be vigilant and watch for anything that comes through with those types of things. That's going to be of utmost importance. Assessing the impacts of HHS programs to the health and safety of beneficiaries in the program public. And that's going to be any of the programs that they put in place for patients, for healthcare organizations. So they're going to be taking a close look at that and seeing how HHS is doing with respect to that. Now, the reason why we want to talk about these today is because all of these things, as we've seen in the healthcare industry, if it's happening to HHS, you know that they're going to somehow look at healthcare organizations. We'll get to that in just a little bit. Now, as far as protecting funds go, OIG's oversight and enforcement activities in this regard are for fraud, waste, and abuse, and transparency, basically, with the accountability of any HHS spending. Essentially, it's public knowledge with what the money is going in and out are. But their main objectives for this is to prevent, detect, and remedy waste or misspending of COVID-19 response and recovery funds. We knew that this was going to come out. We knew that they would have to have some sort of oversight over it just to make sure that HHS is doing what they say they're going to do with the funds and that it's handled all appropriately, and that there's no fraudulent activities. as you saw in that previous slide where we talked about some of the fraudulent activities going on, that's why they're really looking into this. And then finally, fight fraud and abuse that diverts COVID-19 funding from intended purposes or emergency flexibilities granted to health and human services providers. That's a big deal. As you've seen in previous webinars that we've talked about, where you see these scams with people offering miracle cures and trying to bait people into, spend their funds in those healthcare organizations. That's one example of how they're looking at where those funds are going and what's going on with that. They want to make sure that the public and healthcare organizations are equally protected. So this is really an important goal with them. Also, what I wanted to talk a little bit is protecting infrastructure. So with this, we're talking about, as we said earlier, IT systems, personal information and data collected by HHS. It's very important to make sure that all that information is safeguarded. That's been a theme for HHS for countless years, and it's going to continue to do so. These bad actors out there, they're targeting healthcare information like crazy right now, and it's an increased in value, and there's unsuspecting people in healthcare organizations who are, getting caught off guard by these criminals. So these cyber attacks are continuing to happen, and it has been since the COVID-19 pandemic started. They're hoping to see a decrease in it, but we want to bring this to everyone's attention just because it's going to require vigilance from healthcare organizations. Now, we didn't put it on the slide necessarily, but with regard to promoting effectiveness, really what OIG is doing there is they're just going to be monitoring the effectiveness of HHS's efforts in this response and recovery plans. In terms of healthcare organizations, we kind of touched on it a little bit, but basically, when we've seen these goals, we can tell that they're very similar to what healthcare organizations are doing. In fact, that's what we're hearing all along is, how can I best protect my patients? How can I best protect my employees? And I don't know which, healthcare organizations have come to us with numerous challenges that they're facing in different parts of the country. And that's been one of the biggest concerns for them is, how can we do it? Are we going to offer remote work opportunities? Are we going to do telehealth visits? What do we have in terms of our infection control procedures and how have we set those up? How am I safeguarding my data and all those types of things, to prevent any harm that could come from a breach? All sorts of things, all sorts of considerations we've seen in terms of protecting people and patients. As far as funds, we've talked a little bit earlier about, how you have an additional 45 days, and that was just one way that healthcare organizations were scrambled, coming up with ways to, how can we protect our funds? Cutting unnecessary things, we've seen that. We've heard from people doing all sorts of different ideas to make sure that they have enough funds to keep operations going. I mean, when we finally heard that elective procedures could start again, it was like a rejoicing for healthcare organizations to get back to business a little bit. Protecting IT systems and protecting health information, I keep stressing that, but that's been very critical. And that's going to be ongoing for healthcare organizations. One of the things we're going to talk about in a little bit is a security risk analysis. That's so critical to your healthcare organization, and making sure policies are in place and safeguards are in place. And we can help you with that. And then, with the effectiveness, think of that in terms of the lessons learned from the pandemic. What lessons have we learned? Well, we know that we can get caught off guard. This thing sneaked up on us so quick and got us, we were all up thinking, oh man, this is going to be a great year. The next thing you know, COVID-19 happens. And it's like, okay, now we got to go back and say, what do we have in place? What are our strategies to handle this pandemic? And the same is going to be true for disasters. Loretta touched on it being hurricane season. I happen to live right in where hurricanes can frequent. So we're watching one currently down there in the Gulf. That's a depression right now. It could become a hurricane. Is it going to come to Florida? Well, we'll see. But, so it's just that time of the year where we have to be on guard. And so the same is true for healthcare organizations. You just don't know what types of challenges can be there. And so we want to offer some tools and some suggestions to help you be prepared in the future, to prepared for potential outages or, you know, but I just think there were a lot of lessons that we've learned from this whole COVID-19 pandemic. And we're looking forward to getting on with it and figuring out ways that these lessons that we've learned from, we put things in place that help healthcare organizations not leave you vulnerable and exposed. Turn it back over to Loretta now.
Thank you, Chad. And that's exactly right. I mean, that is, we've gone through all of these things, and I do believe we have learned some lessons. And so we do want to from those lessons, help you manage your organization better from what we have learned. And, you know, Chad mentioned he's in, you know, in Florida with hurricanes. I'm in California with potential wildfires. So we have all gamuts covered from one coast to the other. So hopefully we can help you guys come up with some good plans. But that kind of leads us into moving forward. So Chad mentioned protecting IT systems and protected health information, and that is so critical. I mean, in whether it's you know, a natural disaster emergency or what we've experienced with COVID-19, or, you know, a number of things, a hacking incident. We want to help you make sure that your IT systems and your PHI is protected. And so some of the topics that we've talked about covering are disaster recovery plans. Do you have one? Do you know how to put one in place? Emergency response planning. And then we talk about it a lot, but that security risk analysis is key to understanding where your protected health information is and how we're going to mitigate any potential threats and vulnerabilities to that information. And also, as Chad mentioned, cybersecurity awareness is big because we are continually seeing situations with ransomware and hacking incidents and protected health information being locked down. And that is something that we have to just be diligent on training your workforce to understand how to avoid those things. And then from a protecting people standpoint, we've had a lot that's come out over the past few months just on employee safety. And so that is a top priority, patient safety. And in addition to those, you know, we've also seen some information coming out from the OCR reminding healthcare providers about Section 1557 and non-discrimination in healthcare in these situations, but even in any regular everyday situations. So these are the topics that we've looked at that we think would be relevant to your organization. But we do want to give you an opportunity to vote, if you will. So our next poll question is going to be, what topic would you like to hear in our next series? And I know we didn't give you a full gamut of choices, but would you like to hear more about security risk analysis, disaster recovery plans, or other? And this is where, if you choose other, I would like for you to take one additional step, and in the chat at the bottom of, you should see that on your GoToWebinar app, if you will just type in your topic in chat so that we can see that. And we'll leave this open for, you know, just a little bit longer than we normally do to give you an opportunity to enter those topics. But Chad and I have talked about this a lot, and we are a little bit of compliance geeks, but we feel like the SRA and disaster recovery plans are big, and it looks like from our poll so far, 62% of you are interested in disaster recovery plans and emergency operations. So thank you for participating in this. Did we have any additional topics that came in, Nicole?
You know what's interesting about that is I think that's what we talked about and planned for, is we figured that would be the most requested topic.
Right.
Yep.
Right.
No questions so far from anybody yet, by the way.
Okay. Thank you, Nicole. Well, thank you guys for participating in that. I did not include a topic on this slide for next week because we wanted to see from the audience what you guys were interested in seeing. So we will be putting that together for you for the webinar on Tuesday, June 16th. We're backing off from our weekly webinars. We feel like the news that is coming out and the updates are coming out are slowing down a bit. Plus, we don't want to wear you out. We want to keep this very relevant, and we want to be very considerate of your time. But we are going to be doing these webinars now on an every other week basis. And at some point, we're going to move back to our monthly, but we do really want to hear from you. If you have specific questions or experiences you'd like to share, or if there's a topic that you just feel like you need more information on, please let us know. You can email us at support@hcp.md, or you can call us at 855-427-0427 and give us that information. Otherwise, thank you very much for joining us today. And if there are no questions, any other questions?
Nope, nothing today.
All right. Well, thank you guys for joining us, and we look forward to seeing you again on the 16th. Take care.
Thank you.